Hello physios. Now I'm going to share you an article about a type of a qigong exercise used for the improvement of fine motor impairment in mild to moderate Parkinson's patients. So you see, this type of study will see a unique one and also a different one. So if you are a researcher looking to for a topic or in your future research, you can have an idea about this. So that's why I'm sharing this article. So they recruited 60 patients with mild to moderate Parkinson's disease, and they have a fine motor impairment, and all the patients are in their medications. And the inclusion criteria is they should follow the simple comments, and they in currently anti-Parkinsonian therapy. So the exclusion criteria, so already they are undergoing any study like behavioral or any study, or they practicing any exercise intervention, so they excluded them. And the person with brain tumor or hand trauma, they excluded this as well. And so it's a randomized control trial, and so they're using so outcome measure, which is a primary one, is the Purdue pegboard test, and the secondary outcome measures are Parkinson's disease questionnaire and Movement Disorders Society Unified Parkinson's disease rating scale. So these are the things. So they have done with the control group. So the control group do a physical activity, general physical activity exercise, but in the type of a qigong exercise they are done, so which is a trial group. So they have doing a 5 minutes warm up and also a 5 minutes cool down. In between the exercise, the qigong type of a qigong they do is for 30 minutes, which is 5 sessions per week. So total 4-week study. So before the intervention, they assess the patients. Their baseline characteristics for both the control and the intervention group is similar. And then so post intervention also they are assessing the patients, the trial participants, and they found out that there is improvement in the two of the outcome measures. The first one, the primary one, is Purdue pegboard test. They have seen the improvement, and also in the secondary outcomes also they have seen. But this study is done based on a previous study, so that's why it's a single-centered clinical trial. So, and also they in the discussion they have said about another article, the another research done, which is using modified vibratory stimulatory training for a fine motor impairment in mild to moderate Parkinson patients. And the limitations of the study is, so it's a single-centered clinical trial. So they are recommending for a future research will be a multi-centered large cohort study, and it's only having very short-term follow-up. So also they recommend for a long-term follow-up study, and they only using the mild to moderate Parkinson's disease patients. So the severe cases we don't know about it. So if you anyone who are willing to do, you can incorporate a chronic one as well. And also the study is done only in a on medication state. So that's it about the limitations of the study and the recommendations they have suggesting for the future researchers. So why I'm sharing this article with you is most of the, especially the bachelor's degree students in physiotherapy, if they are taking a topic, say they go for mostly balance, so these kind of things. So fine motor skill for a Parkinson's disease, it is very quite not quite common. So if you are a researcher, physio researcher, you can incorporate this kind of study, like seeing the fine motor impairment in a Parkinson's disease patients. Other than qigong, you can use any other exercise intervention as well. So thank you.